Universal health coverage is a cornerstone of our transformation agenda and a matter that touches every Kenyan family. Despite health being a devolved function, we acknowledge the immense financial burden that comes with health. Counties have struggled with shortages of medicine, equipment, sometimes staff, hindering service delivery and leaving countless Kenyans with suboptimal access to health care. It would have been easy for me to step back and leave this responsibility to counties alone. But that would have been a disservice to Kenyans and a betrayal to our Constitution. Instead of engaging in debates about healthcare being devolved, I have chosen the hardest but necessary path of addressing this challenge head on. Health delivery is not just about fulfilling a constitutional mandate by whatever level of government. It is about ensuring that healthcare is not a privilege for the few who can afford and a pipe dream for the many who cannot. For years, NHIF was saddled with debts and inefficiencies, and healthcare was being severely and negatively impacted. For far too long, too many households have lived on the edge, just one illness away from financial catastrophe. Our healthcare system has historically neglected the poor and vulnerable, leaving them without any option, while private sector medical covers remained out of reach for the majority. This is precisely what we will correct through the provision of universal health coverage. This agenda is not just about a promise. It is about a bold commitment to deliver health through transformative financing reforms, making healthcare accessible and affordable, digitizing our healthcare services to enhance efficiency, eliminate fraud, and stop corruption, and to empower a skilled and motivated health workforce. To honor our commitment on the universal health coverage, I signed into law 4 groundbreaking legislation on the 19th of October, passed by this August House. The Social Health Insurance Act replaced the outdated National Hospital Insurance Fund and established the Social Health Authority, which oversees 3 essential funds. This modern framework ensures that every Kenyan, especially the most vulnerable, can access quality healthcare services when they need it most. The shift from the National Health Insurance Fund model to Taifa care is fundamental and radical in both scale and character. NHIF, if I give you a bit of example, NHIF served a few salaried Kenyans and those who could afford to pay. But Taifa care covers every Kenyan, regardless of employment or financial status. Secondly, despite serving a limited class of citizens, NHIF nevertheless accumulated billions of shillings of debt because of misalignment between contributions and the actual cost of healthcare. Taifa Care has undertaken an accurate costing of, we have launched an ambitious healthcare program, one that Kenya has always needed and deserved. Like any major transition, there are challenges, but I promise you, we are fully committed to making the system work. As we roll out this program, we are listening to citizen voices and collaborating with counties to deliver better healthcare services. Through the Facility Improvement Fund, which you in this House passed, we will ensure that hospitals are equipped with the tools they need, medicine, equipment, and other resources necessary to provide quality care, while involving citizens in decision-making at every facility. We are now doing the heavy lifting clearing decade-old debts, ensuring access to medicine and equipment, and stabilizing a system that had failed too many for too long. We are building a healthcare system that serves every citizen with equity and dignity. Over the past month, we have disbursed Kenya shillings 5 billion to settle historical debts owed to the public, private, and faith-based medical facilities, some of which have been pending for over a decade. Another 3.7 billion will be disbursed tomorrow. This underscores our commitment to ensuring uninterrupted delivery of healthcare services, and we will continue to clear the remaining balances in a phased-out approach over the coming months. This sustained effort aims to restore confidence in the healthcare system and ensure seamless access of quality services. Honorable members, there is a compelling body of data projecting that not only is the future of humanity urban, but also that Africa has the fastest rate of urbanization. Kenya is no exception, and in fact, many of our counties are urbanizing rapidly. Dear Kenyans, we have a date with an urban future, and the only choice we have is what this urban future will look like. Will it be characterized by decent, dignified, safe, and livable neighborhoods and communities? Or will it be haphazard, unsanitary, unsafe slum dwellings? This is the fundamental question that our affordable housing plan seeks to answer. Kenya has a serious housing deficit, and the cost of housing is beyond the reach of the majority. While the social and economic efforts of this shortage are far-reaching, rent as a component of the cost of living is unsustainable. People are forced to choose between enduring long, punishing commutes to faraway homes or taking up less desirable spaces within reach. Supplying the number of units required to fill the affordable housing gap requires us to undertake construction throughout the country at the rate of 200,000 new housing units every year for 10 years. Many people have asked why they should be interested in affordable housing projects in rural areas. If you look around, you will witness the signs of urban.
Initially, our NHIF would cover only 20% of our Kenyan population. Right now, we are rolling out to enroll each and everybody, the 55 million people. We are not leaving anybody behind. This is a bottom-up approach. Anybody who is earning salary of 30,000 and below, they will be paying lower than they have always paid at NHIF. I'm calling upon all Kenyans that star 147 hash is the number to dial, and ensure if you are to be assisted to register, then look for a community health promoter. You can be assisted at any SHA offices or any health facility where you have intellect and where you have staff who can assist you to register to the Social Health Authority. We are registering households. Ensure you register your wife or your husband as a dependent. Ensure you register the children as your dependents. Do not register as an individual, but as per household. Initially, our NHIF would cover only 20% of our Kenyan population. Right now, we are rolling out to enroll each and everybody, the 55 million people. We are not leaving anybody behind. This is a bottom-up approach. Anybody who is earning salary of 30,000 and below, they will be paying lower than than they have always paid at NHIF.